Nuffield, Darzi. I wanted to ask you about integrated care, which is the topic of one of our main discussions at the summit today. I wonder, could you tell me, why do you consider that integrated care is important for the NHS as we look forward to the next few years?
I think on one hand, it's probably the most important thing to do, but on the other hand, it seems to be one of the most challenging things to achieve. And that's not unique to the NHS, to be honest. I think we're seeing that globally. The reason it's important, and I think in recent times, certainly when you're designing pathways of care and seeing the whole pathway through the patient's eye, it is frightening to see what the patient goes through as far as the care is concerned. It's also terribly more expensive, tremendous amount of duplication, but let's not forget also potentially creates the biggest gap. Fragmentation creates the biggest gap when it comes to safety, let alone quality. So it is becoming more important, but I said, how do you fix the problem remains a challenge.
And are there specific things that you feel are getting in the way of the NHS developing that more integrated care, and organising services around what patients and carers really want and need?
Yeah, I think on one hand, there are many technological innovations which are really driving towards better integration, like information technology, like the ability to provide care at home, sensing technology, whether these are physiological sensing, gait sensing. But it's interesting, if you look at it from the other side, it seems that the incentives aren't aligned in any way to achieve that integration. I think what's missing here is what I described the business model innovation, the creative business models that will bring in the different providers across that pathway of care to work together. Saying that though, if you look at around the NHS, across the NHS, there are many, many pockets of excellence in which true integration has happened. And that is when they've completely discarded all the financial element of this. Groups of leaders have come together and have achieved beyond any belief, actually. They've dealt with all the challenges and redesigned and reprocessed the services at a local level. But that hasn't been, we haven't been able to scale that up, but I think business model innovation might be the way.
Are there things that you've seen internationally that could help? You know, examples you've seen or heard about that you think we perhaps ought to be taking more notice of as we move forward?
I mean, many people say integrated care providers like Kaiser and others, the HMOs, are the way forward. And definitely they are, not in every healthcare delivery, but certainly in sections of healthcare delivery. The challenges that bring is how do you manage that with the competition element? And we know for the last decade, competition remains probably the most powerful enabler in improving quality of services you provide. So integration, whether it's horizontal, vertical, forget the jargon, it's I think, at an organisation level, does have the promise.
And then there's been quite a bit of discussion here at the Nuffield Summit about the need for primary care to change. Yeah. Have you got any thoughts about that, about how primary care might need to look and operate in the future if this integrated care is to become a reality?
Well, you probably remember I've attempted this at some stage in the past, and I think what I got wrong was you can't integrate without the underlying incentives, sorry to come back to the business model, that is required to do so. If you think about primary care, it has two very important functionalities. One of the gatekeeping role, which has always been one of the strengths of our system, and that works extremely well when you have a smaller number of population to look at, because the relationship between the primary care physician, the GP, and the patient and their families is extremely important. On the other hand, if you look what's happening out there in technological innovation, everything is pointing out for a larger population care. If you're really going to shift diagnostics, you know, I've been on the record saying, why would a consultant has to be the signatory for an MRI test and not a general practitioner who more or less has received the same number of years of training? Now, you're going to shift those expensive diagnostics to the community, and these tremendously exciting technologies. You need larger population to make these things cost effective. So reforming the provider end of primary care, I think, is extremely important. But how do you do that without actually damaging that very important gatekeeping role that a GP plays? There are ways of doing that, and that was really the principal philosophy behind in London, the polyclinics and the health centres across the country. Some of them are working well because I think they've got the business model right, and I think the GPs have bought into it. If you look at demand over the next decade, and I'm going to rehearse what the demand is, we all know that, the only way we're going to really address that demand is to really reform and improve the provision of primary care and community services.
Again, as we look forward and beyond the Health and Social Care Bill, I mean, what do you think are perhaps the 2 or 3 key things that we really need to try and get right in the NHS to make integrated care a reality for the future?
I think, firstly, let's go over the Health and Social Care Bill. Once we do that, I think the most important thing is to re-engage the clinicians out there, those who are really delivering the services. How do you drive and promote that? Obviously, commissioning. We need to get these groups to a degree of maturity. You have to remember, commissioning is not a skill. It's only the last decade that we've been trying to improve what we call the payer function, commissioning function of the NHS. If we want to get that right, we need to, firstly, find the right skills. Secondly, I still believe there are too many of them. And how do you manage the larger commissioning groups versus the local needs? And also, at the same time, find ways in which you reform the provider end, both the secondary care and the primary care, and who's going to lead the strategic direction of these different groups. I think there's a gap in there, but I'm sure someone will close that gap, because if we don't do that in parallel to each other, I think we're going to lose a good few years, and I think the challenges will get even worse.